Hello, this is Dr. Riley again. Today, a little bit different. I'm going to present a case. It's going to be someone that we saw in the office. Again, I'm Dr. Riley. I'm a pediatrician. I'm also an obesity medicine specialist and a diplomat of the Board of Clinical Lipidology. Um, so, one of the things that I'm seeing a lot in the office lately are girls who are presenting with elevated testosterone levels, which girls need to have a bit of testosterone, but they're not supposed to have too much. And if they have too much, they present with a whole host of problems from abnormal menstruation to acne to losing hair to even like mood disturbances where I see them getting depressed. And wouldn't it be great if we could find these kids first? So I'm going to show you a kid that we were able to discover her hormone abnormalities before she presented with too many of these kind of problems. So a patient comes in, it's just for a well visit. She's 17 years old. And because she's coming for a well visit, the provider goes over the chart. And as they go through the chart, they actually see some old bloods that were ordered a few years ago. And they notice one thing. They see that the triglycerides were elevated, right? And this is a thing that doctors will look for. Usually at a certain age, they'll be checking for cholesterol, and part of that is to look for the triglycerides. But triglycerides are very interesting. So triglycerides are actually something that your body makes in response to sugar, right? So when you eat a good bit of carbohydrates or any other kind of sugar, it produces the triglycerides because your body doesn't like to have too much sugar inside of it. In fact, it usually tries to keep that level fairly low. At any given time, you only have about a teaspoon of sugar kind of swimming around in your blood. And if you have too much of that, then you get diabetes, right? So then that's bad. So your body knows this. It's not dumb. So what it does is it actually converts it into this handy dandy form called triglycerides, right? And that actually, when we gain weight, most of the excessive fat that we store in our body is actually in the form of triglycerides. But I'm sure this was kind of surprising to the doctor when they saw that because this was this girl's growth chart, right? And this is her BMI, which BMI is what doctors look at when we try to see if someone is perhaps gaining too much weight. And if anything, when we look at this, we could see, just to orient you, over here is usually the average person. Over here are usually the kids who come to see me because they're struggling with weight gain. So if anything, this kid is like totally skinny, right? So so this is kind of weird, right? Why is this skinny kid presenting with high triglycerides? But this is a thing, right? Now, some kids can have actually elevated the triglycerides because they have rare genetic abnormalities, but I see this a good bit, right? I see these skinny kind of kids where their diets are not so good and they present with elevated triglycerides. So what do? You order more blood. Doctors are good at this, right? So we that's what we did. We ordered some more blood, and lo and behold, we saw that the triglycerides were again elevated, not as bad as last time. So you could see here it's actually 126. And very interestingly, not every lab would actually highlight this for a doctor as being abnormal. And yet you'll see in a minute it is abnormal because the doctor who saw the kid, when they saw that the triglycerides were elevated, they knew there was an association that when the triglycerides are elevated, sometimes the kids will have abnormal hormones, right? And uh, the same things that cause the triglycerides to become elevated also cause the testosterone to become elevated. And when we see this um, in this repeat lab, we see the testosterone is 43, which this is not something we want to see in a 17-year-old girl. And so when you're a doctor, you start saying to yourself, what exactly is going on? This kid is presenting with elevated triglycerides. This kid is presenting with elevated testosterone. There's definitely something that we're doing that is not good for our health, right? So and normally for me, it's normally going to be something that they're doing that's actually going to be excessive sugar or processed sugar inside of their diet. So there are some things. So like very interesting in this picture, they talk about the fat-free milk, which is actually something that we know that for some reason, I think it's probably because the fat-free milks actually have extra sugar, but that seems to be a thing that can actually make kids elevate, or make girls especially elevate their testosterone. But really ask the same thing we ask for almost every kind of medical problem, right? What are you eating? What are you drinking? What time do you go to sleep? Are you exercising? What time do you eat? All these kinds of things, right? So, yeah. So, what we find out when we talk to her, we find two things that are particularly disturbing, right? That she has become a fan of smoothies. In fact, she makes smoothies and would rather have smoothies than actually really like food. And, this is a thing that smoothies have this reputation for being healthy, but they're actually not really too healthy, right? Especially if you make them mostly with fruit. Yeah, they have nutrients, but they also have a lot of sugar, right? And it is actually a thing that we know that when you blenderize fruit, you're actually causing the fructose that's in the fruit to be released into your body very quickly. And that actually causes a very big spike in your insulin, which causes more inflammation in your body, and that's actually not so good. Um, and then she was not sleeping, right? Now she's a very good student, so she was, if it was during a time where she needed to study, she was not going to sleep more. Even though I tried to explain to her that getting enough sleep actually helps you to store memories better in your brain, and actually by keeping herself from sleeping, she's actually ensuring that her grades would not be as good. But because she's very smart, I don't believe that she believed me that much, which most of the kids at this age don't really believe me too much, because they feel like, if how could it be wrong if all their friends are doing it, right? But it is something that we know very well in studies, that if you do not sleep enough, that causes inflammation in your body, and it does make all these things much worse, right? Um, and so there were other things, but these were the two things that she was willing to change, right? Because it's always, the thing is that we're 17 years old, right? I can tell you stuff, but they don't necessarily listen to you. So if we can negotiate with them, then that's the best way. And really, it's the same thing with everybody. You have to try to kind of suss them out and see what kind of things are they willing to do, right? And if they're willing to do, then that's fine. Um, this is always part of it, right? That you have to kind of find out what things that they're willing to change and to make themselves healthier. Because really, whatever goal they have in life, being healthier lets them get that, right? So luckily for me, it was the kind of thing that she was entering a time where she was going to be able to sleep more. And the smoothies, once they understood that the smoothies were were totally bad, they were able to decrease the amount of sugary drinks in the diet. So then that's what we said. We said, okay, don't ask for perfection. What we'll do is we'll see. You do what you can do that's easy, and then we'll recheck the bloods. And if they're good, they're good. If they're not good, then we'll try to see if we can make other changes, try to find other things that we can do. Or, at the worst case scenario is that we might have to prescribe a medicine. There's definitely a thing, like, especially I'm sure adult patients, they don't want to change their lifestyle, so they'd much rather take a pill to cure their ills. So it's the kind of thing, though, luckily, most kids, they're much smarter than adults. They don't want to go through life with a Ziploc bag full of pills. So they actually are willing to make changes. So she said, fine, check my blood again, Dr. Riley. I'm not a big chicken. And then lo and behold, the repeat bloods, the testosterone is now solidly in a normal range, right? So, so usually when I see this, I'm like, woohoo, that's excellent, right? Because we were able to like prevent a lot of problems. And when you're a pediatrician, this is actually your life, right? We're very big on giving vaccines because we don't want to visit people in the hospital getting sick because they like to gamble with their health. So the same thing, like once you find that a kid has a problem, and they're a smart kid and they're able to make it go away, then yeah, then it's the kind of thing, why not, right? So yeah, so for the future, for people who are watching this video, what are the takeaways for this kind of encounter? It's that, yeah, so um, this is a thing that when I was a young doctor, we would see someone skinny like this and we would never really ever think that they were going to have like a disease that we normally associate with obesity, right? Elevated testosterone and high triglycerides and things like that. And we might have been tempted not to actually draw any bloods. And there are actually recommendations from different organizations that would have said exactly that. But unfortunately, these recommendations usually are made by old doctors who don't know new medicine. So it's the kind of thing that we don't actually necessarily listen to that. So luckily for this kid, that's what we did. And then, yeah, if you see that a kid has hormone abnormalities, then you have to negotiate with them, right? This is one of the problems that used to happen with me, is that I would kind of call up the family, tell the mom exactly what I thought the kid should do, and then nothing would happen because, especially the moms are usually telling them a lot of stuff to do, like make their bed, all this kind of stuff, and it gets moved into all the other things that they're supposed to do, and the message gets lost. But when you bring them in, when you make a negotiation with them, then it has more power, all these recommendations, right? And yeah, I find that this works much better, right? Where the kids actually realize, yeah, this is for my health, right? And and then we make a plan. We say, okay, so your plan, we use what we call motivational interviewing, where we kind of talk to them, and yeah, usually it works very well, where the kid understands this is for health, and you just find out the things they can do and then follow up on it, right? And yeah, and then unfortunately, um, most of the things that I see kids for, most of the time the same problems come up over and over again as the cause, right? Whether I'm seeing them for liver problems or for obesity or for high blood pressure or for high cholesterol, it's the sugary drinks, it's the lifestyle kind of thing. So it's sugary drinks, it's um, the timing of foods, like eating very late at night, like eating sugary foods, like right before you go to bed, or very early in the morning, and then not having enough time for your body to kind of digest, to rest and digest, to being sedentary, especially now with kids doing a lot of virtual learning. A lot of kids are like, when I ask them to put on the pedometer app on their telephones, they tell me they're taking less than 5,000 steps in a day. And I don't think our bodies were meant to do this, right? We were meant to be moving around and getting enough sleep, which, if anything, there almost seems to be this peer pressure not to sleep, right? So we usually just really need to instruct our patients and our parents to make sure that kids have a healthy respect for sleep, because this is definitely something that impacts their health. So I hope that you found this educational, and I'm going to have other videos talking about this kind of problem, because it just seems like I don't have enough hours in the week to see patients to deal with all these kind of problems. So hopefully these videos will be helpful for people in the future, and it will make my life easier and your life easier. Thank you.